Namaskar. Good morning. Welcome everyone to the yoga session. Now let us begin the yoga sadhana with a prayer. Please sit in comfortable and seated posture. Close your eyes. Bring your palms together in a Namaskar mudra. Let's chant Om 3 times. Inhale. Sahenavavato Sahenau bhunaktu Saheviryam karivavahai Tejasvinavadhitamastu Ma vidvisavahai Shanti, Shanti, Shanti. Then touch your eyes and slowly open your eyes. Thank you. Hands down. Now let us start the loosening practices. Please stand up at your place. These practices help to increase blood circulation in the body and give the strength and flexibility of joint. We begin with the neck practices. First start with the proper alignment of the body. Stand straight with feet 2 inches apart and keep hands by the side of the body. Feel the entire weight of the body on the feet. The first, forward and backward bending. Now place your hand on your waist. Exhale slowly and move your head forward and try to touch the chest with the chin. Feel the stretch back side of the neck region. Inhale, take your head back. This time feel the stretch front side of the neck region. Repeat it one more time. Exhale, move head forward. Inhale, move head backward. Exhale, bring your head back to normal position. Right and left bending. Exhale and bend the head to the right side so that the ear moves as close as possible towards the right shoulder. Inhale and bring the head back of the center. Exhale and bend the head of the left side so that the ear moves as close as possible towards the left shoulder. Inhale, bring the head back to normal position. Repeat it one more time. Exhale. Inhale. Exhale. Inhale, bring the head back to the normal position. Then now, twisting. Exhale, turn the head to the right side clockwise, looking sideways, so that try to move chin in a line with a right shoulder. Inhale and bring the head back. Exhale and turn your head to the left, looking sideways. Show that the try move chin in the line with the left shoulder. Inhale and bring your head back to normal position. The next is the rotation. Exhale and bring the chin towards the chest. Inhale and slowly rotate the head clockwise. Exhale, come down. Now inhale, rotate your head back in an anti-clockwise direction. Exhale, come down. Repeat it one more time. Inhale and bring your head to good. Now inhale and bring your head to the normal position. Place your arm by the side. All these practices are effective for improving the neck strength and release your stiffness. Shoulder movement. Inhale, raise the both arms sideways above your head and palm facing outward. Keep the hands parallel in the final position. Exhale, bring your head arm down. Inhale, exhale, inhale, exhale, and bring your arms down. Close your eyes and relax. Open your eyes. The next practice, the shoulder rotation. Inhale, raise the arm by the side of the trunk up to the shoulder level. Turn the palms upward and fold the hand at the elbow. Place the finger on the respective shoulder. Exhale and bring the both elbow together in front of the chest. Inhale, raise the elbows upwards and backwards bending, then circular path. Exhale. Now move the elbows downwards. Inhale. Then continue, repeat one more time. Exhale. Now, the same practice, the anti-clockwise. Inhale, move the elbow downwards and backward. Now, spread the elbow to the side and then stretch out the arms of the side. Turn the palm downwards. Exhale, bring the arms down and relax. Feel the impact of the practices. Let us move to the trunk twisting. Keep your legs shoulder length apart. Inhale, raise the both arms to the front up to the shoulder level, keeping the arms parallel and palms facing each other. Exhale, rotate the trunk to the right so that the left palms comes close the right shoulder. Inhale, return the starting position. Exhale, push the body towards the left. Come back with inhalation. This is one round. Repeat one more time. Exhale. Inhale, exhale, come back with inhalation, exhale, slowly the arms back to the inhale position and relax. Now, the trunk movement forward and backward. Inhale, stretch your arms upward to the front of the bend backward as much as you can. Exhale, bend forward. Place palms to the ground and stretch the back downwards in the comfortable way. Repeat it one more times. Inhale, exhale, inhale and exhale. Bring the hand down. Relax and feel the impact of practice. Ankle movements. Place your hands on your waist. Raise your right foot slightly up. Keep the knees straight. Now stretch the ankle outward and inward. Now rotate your ankle in the clockwise direction 2 times and anti-clockwise direction 2 times. Bring your foot back. Do the same with the opposite leg. Raise your left foot slightly up, keep the knees straight. Now stretch ankle outward and inward. Now rotate your ankle 2 times, clockwise and anti-clockwise. Bring your foot back. Relax. Open your eyes. After loosening practice, now we begin with a Yogasana practice. The first asana is a Tadasana. Stand with your feet 2 inches apart. Inhale, interlock your fingers. Fold your arm in the front of the chest. Exhale, turn the palm outwards. Inhale, raise the hand upward over your head and stretch out. Align your body here first. Stretch. Then raise the heel of your floor and balance on your toes. Maintain the position, the normal breathing. Bring the heel down. Bend your elbows. Keep your hand on head. Relax. Repeat once again. Inhale, reach your arms up and stretch it. Then raise the heel of the floor and balance on the toes. Bring the heel down. Release the interlock fingers and keep the palms facing each other. Exhale, lower the arm sideways. Come back to starting position and relax. This asana provides the balance our body. The next asana, the Vrikshasana. Open your eyes, focus on a point in the front. Exhale, move the right leg up and try to place the foot of the inner side of the left thighs. With the heel place of the close. Inhale, raise the arms shoulder level. Turn the palms upward. Raise the arms up, keeping the straight Join the palms above the head in the Namaskar Mudra. Maintain the final position with a normal breathing. Exhale, bring the arms down to the shoulder level. Turn the palms downwards, bring the down by the side. Release the right legs and bring to the straight. Repeat this practice with a left leg. Exhale, bend the left leg. Inhale, raise the arm up. Maintain the position in the normal breathing. This asana helps in neuromuscular coordination. Exhale, bring the arms down. Release the left leg and bring to a starting position. Relax. Padhastasana. People having severe low back pain shall we avoid these practices. Keep your feet comfortably apart. Inhale and raise the arms up. Exhale, slowly bend forward. Stretch up from the waist. Keep your palm to the ground and slightly bend your knees. Maintain this posture in the normal breathing. Now inhale, bring your arm up and exhale down. Relax. This asana makes a spine flexible and help to improve our digestion. Now we will do Padhastasana. The first practice is the simplified version. The now is the Padhastasana is the final version. Keep your feet 4 inches apart. Inhale and raise the arm up. Exhale, slowly bend forward. Stretch up from the waist. Keep your palms beside your feet. Legs are particular of the grounds. Maintain the position in the normal breathing. Now inhale, bring your arms up. Exhale, bring your arms down. Relax. Feel the effect of asana. Now we will do Ardha Chakrasana. People having giddiness, neck pain and shoulder pain may be practiced with care. Place your hands at the back of the waist. Keep your elbow parallel to each other. Inhale and move the head backwards. Exhale and maintain this position with a normal breathing. This asana improves the lungs capacity. Inhale, raise your head up. Exhale, bring your arms down and relax. We will move to the sitting posture. Please sit. Sit down with your legs straight out. Keep your hands beside the hips and buttock. Straight. Now the Dandasana. First is the Dandasana. Now bend your knees and put the sole of your feet together. Dandasana. Then next is Bhadrasana. Exhale, hold your toes. The practice of a Bhadrasana. Pull your heel towards your body. Keep your spine erect and close your eyes. This is a Bhadrasana. Maintain this position, the normal breathing. This asana keep the abdominal muscles healthy. Now come back to Dandasana. Now we move on to Vajrasana. Fold the right leg at the knee and place the foot under the right buttock, similarly folding the left leg. Place both the feet in such a way of that the big toes touch each other. Good. Position of the buttocks is the space between the heel and feet. Keep your hands on your respective knees. Keep the spine erect, gaze in the front or close your eyes. Maintain this position in the normal breathing. This asana is good for digestion and strength the legs nerves. From Vajrasana, we will do practice of Ardha Ustrasana. Open your eyes, inhale, come up the kneeling position, place the hand of the buttock with a finger pointing downwards. Keep the upper arms parallel to each other. Inhale, bend the head back, stretch the neck. Exhale. Maintain the final position with a normal breathing. Inhale to relieve the lower back pain. Return with inhalation and sit in Vajrasana. Next asana is the Shashank Asana. Inhale, spread both the knees comfortably apart. The first, the simplified version of it. Place a cushion between your knees. Exhale, stretch the back forward and rest the body over the cushion. Relax for a while with normal breathing. Inhale, come up. Now we will do final position, the final posture of Shashank Asana. Inhale, spread both the knees wide apart. Keep hitting the big toes touching each other. Keep the palms between the knees. Exhale and bend forward and stretch the arms to the front side. Chin and chest on the ground. Keep the arms parallel. Maintain the position in the normal breathing. Inhale, come up. Exhale and bring your knees together. Relax in Vajrasana. This asana helps to reduce stress and anxiety. Next asana, Uttana Mandukha Asana. People with severe low back pain, knees pain, stiffness of knees and back shall be practiced with care. Again, spread the knees wide apart with the big toes touching each other. Inhale and raise your arms, palm facing front. Exhale, fold your right arms and place the palms on the left shoulder blades. Similarly, fold your left arms and place the palms on the right shoulder blade. Keep the back and neck straight. Maintain the final position with a normal breathing. This asana helps in the backache and cervical spondylitis. Inhale, raise the arm up. Exhale, bring the arm down and the knee close your each other. Bend the little towards take your right leg and extend it. Relax in a Visrama Asana. Close your eyes. The next asana is the Vakrasana. People with low back pain, wrist pain and shoulder pain and stiffness shall be practiced with care. Now sit in the Dandasana first. First we will do simplified practice of Vakrasana. Bend the right leg and place the foot beside the left knee. Now hold the knees with a left hand and place your right hand behind the body and the ground. Inhale, stretch the back. Exhale, twist the body and head towards the right side. Maintain this position with a normal breathing. This makes the spine flexible and help to overcome diabetes. Inhale and come back. Now we will practice a final posture of the Vakrasana with the other leg. Bend the left leg, place the left foot beside the right knees, bring the right arms around the left knee and hold the arch of the left foot. Inhale, stretch the back. Exhale and twist your head and body to the left. Maintain the final position with a normal breathing. Inhale and slowly come back. Relax in a Visram Asana. Close your eyes. Let us move on to the prone posture. For the Vakrasana, lie down on your abdomen with the feet. Lie down on your abdomen with the feet comfortably apart, toes outward. Bend both the arms at the elbows so that the palms are raising below the face. Now close your eyes and relax the whole body. Remain aware of the body and breathe. Relax for a few seconds. This asana helps to relax body and mind. Now we will practice Bhujanga asana. Bring leg together. Inhale and stretch your arms forward. Rest the chin on the ground. Exhale, place your palm just behind the shoulder with the elbow. Close the body. Inhale, slowly lift the upper body up to the navel without extending posture of the arms. Keep the arm parallel. Maintain this position with a normal breathing. Exhale, bring the head down and rest your forehead on the ground. Now relax in the Makarasana. Now we will do Shalabhasana. Bring the leg together. Rest the chin off the floor. Place both the hands beside the body and palm facing downward. Inhale, raise the leg off the floor as much as you can. Keep the leg straight without raising your chin up. Maintain the final position with a normal breathing. Exhale. Slowly bring the legs down off the floor. Slowly bring the arms back to the initial position and feet wide apart, toes pointing outward. Relax in the Makarasana. This asana, the relief from the sciatica and backache. Now we move on the supine posture. Lie down on your back. Today we introduce the new practice. The first is the Setubandha Asana. Setubandha means the formation of a bridge to the posture, the body and position like a bridge. Hence the name. The Setubandha Asana, the precautions. People suffering from ulcer and hernia should we not practice this asana. So here we will start the practice of it. Bend both your knees and bring your heel towards the buttock. Hold your ankle. If you are not able to hold, then you can give hand straight on the side with your palms. Inhale, raise your buttock and trunk to from the bridge. In the final position, keep the shoulder and the head connect with a floor. Maintain the position with a normal breathing. exhale and come down. Relax on your back. This asana is found beneficial of depression, stretch in the lower back muscles, strength for abdominal organs, improve digestion, and help to relieve constipation. Next asana is the Markat asana. Now bend your knees and keep them close each other. Inhale, slowly move your both arms up to shoulder level and the palm facing downward. Exhale, turn your neck towards the left and move your knees towards the right. Try to keep the knees off. Maintain this position with a normal breathing. Now inhale, slowly come to a state, and exhale, repeat the opposite side. Now inhale, slowly come to a starting position, and repeat it one more time. Exhale, maintain this position with a normal breathing. Now inhale, slowly come to a starting position, then exhale, repeat to opposite side. It improves spine flexible and relieve the low back pain. Now inhale, slowly come to a starting position. Now exhale, slowly straight the leg, relax in Shavasana. Close your eyes. The next practice the Saral Matsasyasana. If you are in the severe neck pain, please don't this practice. Ready for Saral Matsasyasana. Now bring the leg together and place the hands beside the body. Now raise the both arms above the head and place the palms beside the head, and keep the elbows parallel to each other. Inhale with the support of your arms. Slowly lift your chest and to place crown the head on the ground without neck strain. And exhale, slowly release your arms and place over the thighs. Maintain this position with a normal breathing. Now inhale, place your arm beside the head. Exhale with the support of your hands. Allow the release your head and come back to a starting position in the Shavasana. It opens the chest and improves the lungs capacity. They are good for respiratory problem. It's a Saral Matsasyasana. Impact your body. The next asana, the Uttanapada asana. The leg raise posture. The precaution, avoid the practice in the case of low back pain and abdominal hernia. The call asana name is the Uttan Padasana. Bring the leg together and palm facing downward. Inhale, slowly raise both the legs without bending the knees. Maintain the final position with a normal breathing. Exhale, slowly bring down and relax. Repeat it one more time. Exhale, slowly bring the legs. Hold in the normal position. Exhale, slowly bring both the legs down and place them on the ground. Relax in the Savasana. This asana is good for nervous center and help to improve the breathing capacity. The next asana practice the Ardha Halasana. The first is the precautions in the case of back pain and abdominal hernia. Please don't thus practice. Ready for the Ardha Halasana. Bring the leg together. Inhale, slowly raise your legs together without bending the knees and bring them on the ground. The body from hip shoulder should be kept straight. Maintain this position with a normal breathing. Exhale, slowly bring the leg down to the ground without lifting your head. Close your eyes and relax in the Shavasana. This asana is found beneficial in the management of hypertension. The next asana is the Pavan Muktasana. The first is the avoidance is the abdominal injury and abdominal hernia and the severe neck pain. Please don't these practices. Now ready for the Pavan Muktasana. Inhale, bring the leg together, hands by the side of the body, palm facing down. Exhale, bend both knees and bring them towards the chest. Inhale, interlock the fingers and clasp the legs together, just elbow. Exhale, raise the head till the chin close to the knee or touch. Maintain the final position with a normal breathing. Inhale, bring the head back on the rest on the floor. Exhale, bring the both hands and legs back to the floor and relax in a Shavasana. This asana that improves the metabolism. I repeat the same asana one more time. Inhale, bend the both knees, bring the towards the chest. Inhale, interlock the fingers and clasp together, just below the knees. Exhale, raise the head till the chin close the knees or touch. Maintenance this position with a normal breathing. Inhale, bring the head back to the rest on the floor. Exhale, bring the both hands, legs back to the floor and relax. Now, here we practice Shavasana. Shavasana. Straight legs sideways. Relax your whole body. Close your eyes. Become the natural flow of breath, which gradually tends to become slowly. Absorb the movements of abdominal with breath. To relieve the kinds of stress, tension and anxiety. Absorb your breath and relax the whole body. Now, slowly move your toes and fingers. Slowly turn the right or left side and sit down in the comfortably by taking the support of the hand. Sit in comfortable posture, Sukhasana, Ardha Padmasana or Padmasana. Close your eyes. Then let's begin the Anulom Vilom Pranayama. Keep the left palm on the left knees in the Jnana Mudra. Right hand in the Nasagra Mudra. Close the right nostril. The first is the Nasagra Mudra. Exhale the both nostril. They close the right nostril and inhale through the left nostril. Close the left nostril and exhale through the right nostril. Again, inhale the right nostril, exhale through the left nostril. This is a one round. Repeat the 3 more rounds. Keep your breath slowly. This pranayama helps to improve our concentration. Slowly the inhale and slowly exhale. Exhale through the left nostril and relax. The hands in the Jnana Mudra. This pranayama is very good to improve our concentration. Now, the next pranayama is the Bhramari pranayama. In the practice, during the exhalation, slowly make a deep humming sound. Slowly the inhale and exhale with the humming sound. Inhale. 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 Relax. Relax. Now the practice the dhyana. Now once again observe your spine. Keep it straight. Your arms, shoulders and neck should be relaxed. Bring your awareness toward your breathing. Keep your breathing slow and deep. Watch your thoughts and emotion and meditate. Watch your thought and emotion. Your breathing slow and deep. Meditation is the most important component of yoga. It keeps the mind calm and quiet. Meditation brings a clearly in the thought. The dhyan and the meditation is the most important component of yoga. The relax. Now move your awareness to the normal breathing and adopt a visualization in your mind. The Sankalpa. I commit myself to always be in the balanced state of mind. I commit to do my duty to self, family, at work, to society and to the work for the promotion of health, harmony and peace at large. I commit to follow human value and work with devotion for development of the nation. Join your palm for the Santi Patha, the Namaskar Mudra. Inhale the Om, the 1 times. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani paschyantu, ma kaschit dukha bhag bhave, ma kaschit dukha bhag bhave. Om Shanti Shanti Shanti. Slowly, touch your eyes with a hand. Touch your eyes and slowly open your eyes with a face. Thank you. Dhanyavad.
Namaskar. I welcome you all in the day 7 of CYP introduction program. I hope you all have done yoga practical with us. So let us move towards the theory session with prayer. Close your eyes. Join your palms in Namaskara Mudra. Let us chant the prayer together to begin the session. Sangachadvam Sambadadvam Sambho Manasi Janitam Deva Bhagam Yatha Purve Sanjanana Upasate Sanjanana Upasate Sanjanana Upasate. Keep your palms on your eyes. Gently open your eyes. So once again, I welcome you all in the theory session. Today's topic is mechanism of breathing. So first of all, I would like to ask one question, that what is the first action you did when you were born on this earth? Yes, that's breathing. You took breath. That is the first karma, first action you did. And you can live without water and food for days, but can you live without breathing? No, you cannot live without breathing. So, breath is life. It's God. And it is a voluntary action, although it's all involuntary process, but it can be voluntary controlled also. Like other involuntary actions like digestion, like our heartbeat, we take it for granted. We basically take all our involuntary action for granted. So, we have to learn today what is the mechanism of breathing, how we breathe. So, let us get deeper into it. First of all, we will talk about why we breathe, why we take breath. We breathe in order to absorb oxygen and to throw away CO2, that we all know. But the process being absolutely essential for the life of a human being. It is very important to take breath. So, to breathe, we breathe to absorb oxygen and to release CO2. Now, we will talk about respiratory system. The respiratory system is a set of organs like the nasal passages, larynx, trachea, bronchial tubes and lungs that allows a person to breathe and exchange oxygen and CO2. This is the human respiratory system, starting from the nasal cavity, the nose, the nasal cavity, sinuses, pharynx, larynx. In the lower respiratory tract, there is trachea, the bronchial tree in the lungs. Now, the nose, it provides an entrance for the air. It has a cilia inside and mucous membrane. It has two portions, the external and internal portion. In the internal portion, there is mucous membrane. It contains tiny surface cilia, and it is divided medially by the septum. Now, what is the function of the nose? It basically filters the air that you take in. It filters that, removes dust particles, it warms and moisturizes your air. Now, the pharynx, it's a throat, it's a funnel shaped structure. As you can see, it lies posterior to the nasal cavity. After your nasal cavity comes and anterior to the cervical vertebra. It is a common passage for both air and food. Next, the larynx. It's an enlargement in the airway superior to the trachea and inferior to the pharynx. That means कि trachea से ऊपर है and pharynx के बाद है. It helps keep particles from entering the trachea and also houses the vocal cords. Okay. So, it houses the vocal cords. It is composed of the framework of muscles and cartilage bound by elastic tissue. Now, the trachea. It's a tubular passageway for air, as you can see, located anterior to the esophagus. It extends from the larynx to the fifth thoracic vertebra, where it divides into the right and left bronchi. Now, the tracheal wall is supported by 20 incomplete cartilaginous rings. The bronchi are the two main air passages into the lungs, as you can see. They are composed of the right bronchus and the left. And both the bronchus are going inside the lungs, and they are further dividing into many generations and forming bronchioles, and in the end there is air sacs, tiny air sacs like the grapes, like the bunch of grapes. They are known as alveoli, where the actual gaseous exchange takes place. So, these are the lungs, the paired soft spongy, they are the cone-shaped structures, and they are separated medially by the sternum and enclosed by the diaphragm and thoracic cage. The two layers, pleural membranes covering protecting the lungs. So, these are the lobes of the lung. The right lung has 3 lobes and the left has 2. Left is little bit smaller. So, each lobe is composed of air passages are there, alveoli is there, nerves, blood vessels, capillaries are there, and connective tissues. These are the alveoli. It's like grapes, as you can see. The tiny air sacs in your lungs, they are the smallest passageway. There are millions of alveoli in your lungs, and with that you can imagine having bunch of grapes, as I have already told you. This is where the primary exchange of gases occur. Now, how this exchange happens? Gases exchange happens according to the concentration of CO2 and oxygen. So, diffusion occurs between the alveoli and the capillaries surrounding the alveoli. So, what happens when you inhale and there is more oxygen in the alveoli than in the capillaries that is covering the alveoli. So, there is diffusion from the alveoli to the RBCs in the blood, and oxygen enters into the body with the help of that. And when there is excess of CO2 in the capillaries, then the CO2 enters into the alveoli and it goes out of the body. So, diffusion occurs there. This is how much we can breathe. How much we can breathe. The average total capacity of an adult human male is about 6 liters, and the average human respiratory rate is 12 to 16 breaths per minute. It can vary as per the person physical and mental state also. Now, coming to the topic, mechanism of breathing. See, breathing has 2 phases, we all know, we inhale and we exhale like this. Okay. So, within this 3 to 4 seconds, you know how much work a body is doing? Never think about that. So, there is inhalation and exhalation. So, what happens in the body while we are inhaling and while we are exhaling? So, this occurs with the help of the respiratory muscles. First of all, we would like to know about that. There is diaphragm, which is the dome shaped sheet of muscle separating the thoracic and abdominal cavity, and then there is intercostal muscles. They are muscles of the rib cage. They are inside the rib cage, and they are external and internal intercostal muscles. Now, how the breathing happens? What is the mechanism? First of all, we would like to know about how the pulmonary ventilation happens. There should be a pressure gradient. There should be pressure changes. So, what happens? We would like to know about 2 things for this: the atmospheric pressure and the intrapulmonary pressure. So, air always moves from higher pressure to lower pressure. We would like to learn this law, that air always moves from the higher pressure to the lower. So, the movement of air into and out of the lungs occurs as a result of pressure difference between the alveoli and environment. The intrapulmonary pressure is inside the alveoli and the environmental pressure. Like inspiration, why this happens? Because the act of taking air into the lungs occurs when pressure inside the lung is lower than pressure outside the lungs. When pressure inside the lungs is lower, the intrapulmonary pressure is lower, then air will enter into the body. And expiration, when we exhale, the act of breathing out occurs when pressure inside the lung is greater, then air will move out of the lungs. So, this pressure differences in the pulmonary system are induced by changes in the lung volume. Now, we would like to know about the lung volume also, because there is an inverse relationship between the lung volume and the pressure. Whenever there is lung volume is more, then the pressure will be less, and whenever there is more pressure, then the lung volume will be less. More pressure, less lung volume, more lung volume, less pressure. I hope this much is clear. So, the body uses muscles to change the volume of the thoracic cavity. How this happens, we will go into this. this alters the pressure inside the lungs. Body is using these diaphragm muscle and intercostal muscles, these two muscles. An increase in volume, as I have already told you, decrease in pressure. When the pressure will be decreased, so air will move inside and vice versa. So this is mechanism of breathing. What happens when we inhale? The diaphragm contracts, moves down, it descends, flattens, intercostal muscles also contract, the rib cage rises up. So there is increase in volume. When increase in volume, then there will be decrease in pressure. As I have already told you, there is inverse relationship. When there will be lung volume will be increased and pressure inside the lungs decrease, then air will move in, because the atmospheric pressure will be more. So air will move out from more to less. So it will enter into the lungs, and inhalation occurs, you inhale. Now what happens when you exhale? So your diaphragm relaxes, it comes back to its dome shape, again returns to its shape, intercostal muscles also relax and the rib cage go downward and the volume decreases. When the volume will decrease, the intrapulmonary pressure will increase up. Okay? So जब volume कम होगा तो intrapulmonary pressure आपका rise up कर जाएगा. तो जब pressure will be more, then air will move out from higher pressure to lower, the atmospheric pressure in comparison to, so air will move out. Okay? And you exhale like this. You can see when you are inhaling, diaphragm is descending, your ribs are lifting up, chest is expanding. So there is increase in volume and decrease in pressure. Suppose the atmospheric pressure, like it is 760 mm Hg, and now because of diaphragm is moving down and chest is expanding and there is volume is increasing, and now the pressure is 759 mm Hg. So there is a negative difference of -1 mm Hg. So air will move in, because now the atmospheric pressure is more than the intrapulmonary pressure. Then what happens in breathing out? Diaphragm is relaxing, going back to its position, and if you can see, the chest is contracting, and the lungs volume will decrease. The thoracic volume will decrease, lungs volume will decrease, and pressure will increase inside the lungs. Intrapulmonary pressure will rise. Now if I talk about that, if 760 mm Hg is atmospheric pressure and intrapulmonary pressure is 761, so there is +1 mm Hg pressure difference. So air will move out, because now the pressure inside the lungs is more. Intrapulmonary pressure is more as compared to the atmospheric pressure. So this is basically the mechanism of breathing. It depends upon the volume, it depends upon the pressure. Okay, what is the pressure inside your lungs? Once again I am repeating, if the pressure is more, then the atmospheric pressure, the air will move out, and if the pressure is less, then the atmospheric pressure, then air will move in, because gases always move from higher pressure to the lower, like in the diffusion. It depends upon the concentration of oxygen and CO2. The diffusion occurs between the alveoli and the capillary. Similarly here also, it depends upon the pressure inside the lungs and in comparison to the atmospheric pressure. Okay? And that depends upon the volume, and that depends upon the muscles. So there are also neural and chemical regulations of breathing. In brainstem there are medullary centers, and there are inspiratory and expiratory centers that send impulses to the diaphragm and intercostal muscles, and that can impact your breathing rate. There are pontine centers also that can control your depth of breathing and rhythm of breathing also, that coordinates with the medullary centers. There are receptors also in medulla that send signals, impulses to the muscles, respiratory muscles, and they work according to that. And also there are stretch reflex in the lungs that can also decrease the speed of breathing. There are irritant receptors also in the lungs that can decrease the speed. So now there are type of breathing. There are 3 types of breathing I will talk about today. First is the diaphragmatic abdominal breathing, second is the chest or thoracic breathing, and third is the clavicular breathing. So what happens when the diaphragm moves down, descends down, abdomen comes out, this is known as diaphragmatic breathing. It is a deep breathe. ठीक है, have you seen any child sleeping, infant? Their abdomen rises with the movement of the breath. When they inhale, abdomen is rising up, and when they exhale, it's going down. This is abdominal breathing. So it is a natural way of breathing in line with the structure of a body, and it pushes the diaphragm down with inhalation and releasing the abdominal organs outward. You can feel the abdomen is rising up. There is expansion of the belly as a result. Now, abdominal breathing, it optimizes the lung capacity and it reduces stress because it makes the breathing more rhythmic and more relaxing. Just take a moment and check your breathing. Place your hand on the navel and check. When you're inhaling, your abdomen is coming out or going inside. If you are in stress, chances are you will feel your abdomen is going inside rather than outside. As per experience with the patients, when they are under stress, the chest is moving more than the abdomen, and that shows they are under the fright and fight response. In the emergency situation all the time, those people have more of thoracic rather than abdominal breathing. So we should learn abdominal breathing and practice it to counter stress, anxiety. Now the chest or thoracic breathing, there is heaving of the chest or rib cage, as I already mentioned. The rib cage expands in all directions with inhalation, but abdomen will not come out. So with an exhalation, the ribs revert to their original position. Now here intake of oxygen is lower than in abdominal breathing, so breath tends to be fast. The unconscious use of this form of rapid breathing creates heightened state of tension. See, you are not in tension, but if you are doing more of thoracic breathing, your body will think you are in tension and you will behave like that only. So to break this cycle, slow and deep abdominal breathing is of great assistance. We should always practice. But a thoracic breathing is also a powerful breathing technique for healing respiratory ailments. So in some cases where there is less of chest expansion, then it also helps. Like this you can do, you can place your hands on the lower ribs and you can feel when you are inhaling. You can feel the chest expansion, exhale, it's going back to the position. Just close your eyes and feel the movement. Yeah, like this. So the last of the breathing is clavicular collarbone breathing. With this type of breathing, the air is flowing inside the top of the lungs basically, and your clavicles, collarbones are lifting up. They are lifting up. The upper part of the chest, collarbones are lifted, and with the exhalation they go lower. Like this, you are placing your hand on the clavicle, and when you are inhaling, it's going up, exhaling, moving down. You can feel it. Just practice along. So this is clavicular breathing, but it occurs mainly in the situations of extreme stress and panic. They also have their own importance. It's not like they don't have their importance. Suppose you are in a jungle and suddenly lion comes and you need to pass. So this is basically for that type of situations, thoracic and clavicular breathing. But what is happening nowadays, that we are constantly in this state and we are using more of thoracic and clavicular breathing rather than abdominal breathing. That is a problem. We are not like child who are not in stress. We are taking stress all the time, all the tensions, and that is why our breathing is shallow. It's not deep. So we should always learn to breathe deeply. You can practice this in our practical sessions also, that when you are inhaling, your abdomen is moving out, diaphragm is going down, it's completely deep breath, and when you are exhaling, it sinks in. So this is excellent practice for those people who are suffering from stress, anxiety, and this is all about the breathing, mechanics of breathing. Let's revise once again. So when you're inhaling, diaphragm is contracting, it's going down, and ribs are lifting up. So there is more of volume in the lungs, and when there is volume is more, then the pressure will be less as compared to atmospheric pressure, the intrapulmonary pressure is less. So, air always moves from higher pressure to lower. Now, the pressure outside is more rather than inside, so air will move in. So, this happens in inhalation. This is very much clear. Now, what happens in exhalation is diaphragm moves back to its position, it relaxes its dome shape again, and your ribs also goes down, rib cage, and what happens now, there is decrease in the volume. Okay. Now, when the volume is less, then the pressure will be more. When the pressure rises up as compared to the atmospheric pressure, now the atmospheric pressure is low and atmospheric pressure is low and inside intrapulmonary pressure is high. So, air will move out from the lungs out in the atmosphere. So, this basically we need to learn about the muscles involved in breathing, the respiratory centers involved. This is all about the mechanics. I hope you all enjoyed this lecture session. We will continue with another theory session tomorrow on pranayam, and we will go for control of respiration tomorrow. We will talk about control of respiration and pranayam. So, let us end the session with prayer. Close your eyes, hands in Jnana Mudra. Keep your hands on your eyes, open your eyes. Thank you so much for joining in. We will meet here tomorrow same time, and Jai Hind, Jai Bharat. Namaste.